Welcome, everyone, and thank you for joining us here. My name is Christie. I'm happy to introduce this this session. In the interest of time, I'll just do a very brief introduction and then let my collaborators get on with the meat of this presentation. First and foremost, I'd just like to thank CASCADES for helping us organize this webinar. CASCADES is a Canadian national project that's funded through the Environment and Climate Change Canada. There's a number of partner organizations, of which we are fortunate to be one. One of the main focuses of this initiative is to improve climate awareness, particularly with regards to sustainability and healthcare, and we really appreciate their collaboration and support in putting this event on. The topic today is a presentation of the newly launched HealthcareLCA database, which is a collaboration between the researchers at Brighton and Sussex Medical School, as well as here at Dalhousie and Halifax, and we'll hear a little bit more about that as we move through this seminar. Would you advance the slides, please? Just in terms of introduction, I can't see who's on the webinar, but I suspect it's of little news to people that we are in a climate crisis, and this is largely due to increase carbon dioxide emissions from human-related activity. And we're rapidly approaching, if not on a trajectory to exceed the recommended, or the suggested cap, I should say, 1.5 degrees C above pre-industrial levels. Next slide, please. This has a number of impacts across the world, and where we are in the Northern Hemisphere, I think the ice cap is where we're seeing this quite frequently, but this is really has a disseminated problem globally with increase in sea levels, to name one. But I think there are a multitude of examples of how this negative impact is influencing people around the world pretty well on a daily basis. Next slide, please. So I think perhaps some of you today heard Secretary General Antonio Guterres's plea from this morning at the World Economic Forum that we really need to change course, and it's gone past a point of urgency to a point of crisis, and we really need to make a move. And I don't know that we can, in this group, address all the concerns and suggestions that Secretary General put forth today, but I think what we'd like to focus on is where we, next slide, in healthcare can have an impact. And certainly it's been known now for quite some time, since the Lancet Planetary Health reports have been coming out, that the healthcare sector is a big part of the problem. And this really transcends all the health systems, next slide, to a varying degree across the planet, but we all do contribute to this. Unfortunately, some of us more than others, and I think we all need to figure out a strategy or a way to improve things for the betterment of the planet. In order to do that, we need to first figure out an understanding of what's contributing to these emissions, and then we can start to look for solutions. And I think that one possible way that we can learn from this and we can make some positive changes is to reflect on some of the data that'll be presented today. So with that very brief introduction, I'd like to turn it over to my collaborators. First is Dr. John O'Drew, who's a junior doctor in Dunedin Hospital in New Zealand. He has an adjunct position within the Department of Surgery here at Dalhousie, and this is where, when he was visiting with us, we got this work started. He's also a scholar within our Healthy Populations Institute, which is a partner with CASCADES. And he has research ties with the Climate Health Ataria research stream at the University of Otago in New Zealand. Before he got into health, he had a background in food system sustainability, but now his thrust is more in healthcare sustainability. And John will run us through the nuts and bolts, if you will, of the HealthcareLCA database. And then Dr. Chantelle Rizan, who's a clinical lecturer in sustainable healthcare at the Brighton Sussex Medical School, our other partner, will wrap up the session. And Dr. Rizan recently sat her Viva-based their PhD thesis on ways to mitigate carbon footprint of products used in surgical theaters. And she's hoping to translate her research into practice, and is a founding member of the Royal College of Surgeons of England Sustainable in Surgery Working Group. And she also serves as an academic advisor for a national report on net zero in collaboration with UK Health and Climate Change Alliance. And I think that the proactive work that's being done in the UK and the NHS system should be a good example for many of the rest of us that practice in other health systems. And I think Dr. Rizan is a big contributor to that, and she's going to help inform us a little bit more. So without further ado, I'll pass things over, and thank you all once again for your attendance, and to Cascades for facilitating this webinar.
Okay, thanks, Sean, for the introduction, and thanks again to everybody for coming along today. We really appreciate it. In terms of an agenda, I'm going to begin by talking a little bit more about what HealthcareLCA is and why we feel it's important. We'll then watch a short video that provides a bit of a tour of the database, and I'll briefly discuss how various users or stakeholders might find the database to be useful in their own work. We'll then take a bit of a look at a few charts that summarize some of the data within the database, and then I'll hand over to Chantelle, and she'll discuss some of the limitations and implications of our work. We'll finish off by talking a little bit about how the database is currently maintained and supported, and then we'll open up the discussion and have some Q&A time. And the Q&A is open at the moment, so feel free to post your questions in the chat as we go. So what is HealthcareLCA? In short, HealthcareLCA serves as the first global living database of healthcare-related environmental impact assessments. So while researchers around the world are working hard to both assess and identify ways to reduce the environmental impacts of different aspects of healthcare, the HealthcareLCA platform serves as an up-to-date repository for this work, bringing together new and existing assessments into one centralized location. Now, our database is very broad in scope and includes research relating to really any healthcare field, including medicine, surgery, dentistry, pharmacy, primary care, and so on, and conducted at any scale. So whether it's at the equipment, pharmaceutical, procedure, service, or even the system level. Our project is also what we call living in nature, which means that our team continues to identify and add new studies to the database as these become available. And finally, the database is both interactive and open access, allowing users to freely explore the available data, begin to learn about the environmental impacts of healthcare, and in some ways ask questions and find answers. Now, at the time of our talk today, the database spans about 20 years of research and includes more than 175 studies, providing around 4,000 individual environmental impact values for more than 1,400 healthcare products or activities. And collectively, these studies have been authored by more than 700 authors from 300 institutions, some of whom are likely to be with us today. So thank you very much for your contributions to the field. So why do we think the HealthcareLCA database is important? Well, our awareness about healthcare's contribution to global environmental change is growing, as is our willingness to do something about it. 22 countries have already committed to achieving net zero health system emissions, and a total of 56 nations have made commitments to make their health systems sustainable and low carbon. I suppose the crucial question is how are we going to get there? And we feel that our success will ultimately depend on, at least initially, on a couple of things. The first being the rapid quantification of healthcare's environmental impacts, basically across all levels of service provision. And secondly, the timely communication and ready availability of that data for all relevant parties, including health sector managers, policymakers, procurement teams, administrators, and obviously healthcare workers themselves. And it's really this latter aspect, the communication side of things, that HealthcareLCA intends to play a key role in. So now we're going to watch a short video. It's about 10 minutes long. And the video introduces some of the key features of the HealthcareLCA website, and that's where the database itself is housed. And by running through a series of examples, the video essentially gives people a sense of how they might navigate and interact with the data. So I'm just going to go ahead and get it started for you now. Just give me a second.
So here we are on the gallery page. If we scroll down, we can see a gallery view of all of the studies that are included within the database to date. This page offers a visually appealing view of the data, with each individual tile representing a single study. By default, the data sources are ordered by publication date, with those most recently published appearing here at the top. I'm going to click on one of these tiles. Let's start with this one here that looks at the environmental impact of surgical scissors throughout their so-called life cycle, meaning all the stages involved in producing, packaging, transporting, reprocessing, and disposing of them. So we can see a pop-up summary of the data source, including the study's title, authors, publication year, abstract, citation, publication date, link to access the study itself, publication type, and the journal it was published in. We can then see the individual products and processes that had their environmental impacts evaluated. And as we scroll down further, we can see information about the study's methods, including its setting and functional unit, the unit on which environmental impacts are compared, in this case, one use of a pair of scissors, the boundary of analysis, in this case, looking at the entire product lifecycle, which lifecycle stages were included in the analysis, and which environmental impact categories were assessed. In this case, a broad range of parameters, including climate impact, as well as acidification, eutrophication, ecotoxicity, and so forth. If you're not sure what a certain data variable is referring to, you can simply hover over the little I symbol for a definition. At the very bottom, we can see the competing interest statement and funding declaration from the study. If you're finished looking at a particular study, we can close the pop-up by clicking the little X or anywhere outside the box and return back to the gallery view. Now you can continue browsing through the gallery if you like. There are currently close to 200 studies included. So I'm just going to come back up to the top now and show you the filter and search functions, which you can use if you happen to have a particular interest or question in mind. So let's say we're interested in studies from a particular country. We can click the filter button here, choose to filter by country, and then toggle on and off the countries of interest. For example, if we only want to view studies from the UK, we can click here, or if we want to view studies only from the United States, then we can toggle off this button and toggle on here. We can also combine filter conditions. So say we're interested in studies from the US that are related to surgery. We can click here, add a new condition, filter by healthcare field, and then select surgery. Even more specifically, perhaps we're interested in US-based studies that looked at the impacts of surgical procedures. Then we can add a further condition based on a scale of analysis, like this. If at any time we want to remove any active filters, we can simply click here again and then click the trash symbols like so. You can also search the gallery by selecting the search icon up here. This allows you to type in any keyword of interest and be shown the relevant studies. For example, if I type in face mask, it will highlight any study that makes reference to face masks. So we can see here that there are 11 search results, and we can toggle through them by clicking the arrows here. Once you've finished searching, you can simply click the X here. So that's a quick summary of the gallery page. Let's move on now to looking at the database in a more traditional format. So I'm just going to click up here on the database tab. So here we are on the database page. This presents the same studies that are shown within the gallery, but in a spreadsheet format. The key difference between the gallery and this view is that here we can begin to explore the environmental impacts that have been reported within each study. The Products and Processes tab in the upper left-hand corner of the spreadsheet is the default view. In terms of the way the information is presented here, you're seeing a more detailed breakdown of what each study actually assessed. Let's begin by looking at the same example that we looked at previously, which was surgical scissors. I know it's right here near the top, so I'm just going to scroll down a little bit and find it. So as we discussed earlier, this study examined the environmental impacts associated with the life cycle of these scissors. More specifically, we can see here that impacts were reported across 3 different reprocessing pathways. In other words, different steps were taken to allow for the ongoing reuse of these scissors in a surgical setting. These included not repairing them off-site, and repairing them on-site. So if we scroll across, we can see all of the same information that was presented in the gallery view, including all the descriptive details about the study and its methods. The key difference is that at the end here, we begin to see the actual numerical impact values. So sticking with our surgical scissors example, we can see that the global warming potential, or climate impact, is reported on, as is ozone depletion potential. And if you continue scrolling across, you'll see all of the environmental parameters that were assessed by the study. To compare impacts more easily, I want to show you the hide fields function. So if we click here, we can see that all data fields are currently displaying. So let's begin by clicking hide all, and then selecting the ones we are most interested in. For example, country, year of data collection, functional unit, system boundary, and global warming potential. So we can now easily see that over the entire life cycle, from cradle to grave, one use of a pair of surgical scissors is associated with between 0.05 and 0.07 kilograms of CO2 equivalents, depending on how those surgical scissors were reprocessed, with on-site repair being the most climate-friendly option, according to this study. Okay, so let's switch it up a bit now and look at how we can filter the data according to our individual needs. To begin, let's say we want to learn about the climate impacts of different drugs. We can come up here and select Filter, just as we did on the gallery page earlier. If we choose to filter by scale, we can then adjust the toggle settings to be shown only those studies that relate to pharmaceuticals. As we scroll down through the results, we can see impact estimates for various pharmaceuticals, including vaccines, antibiotics, analgesia, monoclonal antibodies, anesthetic agents, and so forth. Alternatively, we might be interested in clinical investigations, and we can simply adjust the filter settings here to toggle pharmaceuticals off and investigations on. Now we can see the climate impact of different laboratory tests and imaging modalities. One aspect of the HealthcareLCA database that's really neat is that it documents contributions to numerous environmental impact categories, not just climate change. So for example, we might be interested in the ozone depletion potential of healthcare equipment. And so we can simply adjust our view to reflect this by toggling off global warming potential and toggling on ozone depletion potential. and by filtering the database to show equipment-related studies only. We can then see ozone depletion potential estimates for different items of healthcare equipment, wherever they were documented by the original studies. Finally, I wanted to show you some of the higher level data that focuses on the climate impacts of national health systems. So if we switch back to global warming potential here, and then adjust our filter settings to show only those studies conducted at the system level, we see a long list of health system impact estimates. If we tidy this up a little bit and use the group function to group estimates by country, and then the sort function to sort estimates by year of data collection, then we can easily see available estimates of annual greenhouse gas emissions associated with various national health systems, with the most recent estimates listed first. So that's a brief summary of how to navigate our database. Before we finish, I just wanted to show you the HealthcareLCA search tool, which can also be found on the database page. This search tool allows you to search for any keyword and be shown any and all matching results. For example, if we search for inhaler, we will be presented with a long list of all of the various inhalers that have been studied to date. If we want more information about a given record, we can simply click on it and see a pop-up summary with the impact estimates listed right here at the end. That concludes this tutorial. Please explore the platform yourself by going to healthcarelca.com. If you have questions, our contact details are available on the website. Thanks for listening and take care.
Okay. So I hope that you all found that tutorial to be useful. Sorry about the YouTube ad in there. Wasn't expecting that. I think the YouTube video gives a reasonable overview of how we can interact with the database according to our own individual needs or interests. But I did just want to run quickly through a few examples of how we feel that the database might be useful to specific user groups or stakeholders. So the first example here relates to healthcare workers. And this group is likely to be increasingly interested in learning about the environmental impacts of their own practice, but they might not necessarily know what research exists, how to find it, or more likely they just don't have the time to even search for it. And it's in this regard that HealthcareLCA provides a single one-stop source of data that's easily filtered by specific healthcare field or discipline, and allows users to freely navigate the data and begin to understand the magnitude of impact associated with healthcare products or activities, and also in some ways to begin to identify lower impact options. But we'll talk a little bit more about data interpretation later on. Secondly, if we consider how healthcare sustainability researchers might interact with the database, we know that this group wants to be kept up to date with the field. They want to understand where literature gaps exist, so as to inform new studies and funding applications. They also want to know how other research groups are conducting their studies and where they are sourcing their data from. So for researchers, our platform offers notification, for example, via Twitter or email of when new studies are published and added to the database. It provides summary charts and metrics that highlight important research gaps. And it also details all of the methodological techniques, or at least the most important ones, and data sources for each included study. Finally, if we think about policymakers, we know that their priority is to take an evidence-based approach to setting policy and prioritizing action. And HealthcareLCA is designed in a way to facilitate ready review and synthesis of the available data, providing summary metrics that help to identify impact hotspots, as well as areas where further research and innovation are required. So now I wanted to look briefly at a few charts that summarize some of the data currently housed within the database. Now, these charts and a number of others are available on the HealthcareLCA website, and most of them will update automatically as new studies are entered. This first chart here is from our recent paper in the Lancet Planetary Health, and it simply shows how fast this field of research is growing, with the number of available studies having more than doubled over the past 3 years, and the field itself having been virtually non-existent 20 years ago. Now, the various panels simply break down studies by their scale of analysis and healthcare field and world region and so on. I'm not going to go into that in any more detail here, but feel free to have a look at our paper if you're interested. Here we're looking at the geographical distribution of healthcare products and activities that have been assessed to date, with most situated in the UK, in the US, and then followed by Australia. And finally here, we're looking at the geographical distribution of author institutions that have been involved in contributing to this field to date. And we can see that this is truly becoming a global research field, which is really exciting. So I'm gonna hand over to Chantelle now, and she'll talk a little bit about the database's current limitations and provide some guidance on data interpretation. And then she'll briefly cover how our database is currently supported and maintained. So Chantelle, I'll hand over to you.
Great, thank you ever so much, Johnny. And I'm sure for those of you who've joined us this evening, hopefully it's clear that this is a powerful and useful resource, but actually we do need to recognise some of those limitations. And it's really my job now to apply a little bit of a health warning in terms of how we actually interact with the database and some of the results that are then provided there. And I think it's always helpful to bear in mind that the absolute results that are provided within a life cycle assessment or a carbon footprint are limited in and of themselves in terms of the absolute figures that are provided. And we wouldn't advise that the end results are compared between different studies, and in particular between author groups. And there are a number of reasons for that. Some relating to the actual functional units, so the units of analysis that are studied. There will be slight differences, even if on the face of it they seem to be the same, based on the specifics that are evaluated within a given study. And there may be other contextual differences, for example, relating to the energy supply that's used, or factors relating to the transportation and so on. And there'll also be differences between studies in terms of the methodological approach. For example, some might use a bottom-up process-based approach, and others will use a top-down environmentally extended input-output model, and others will use a hybrid. Those different methodological approaches are specified within the database, but it's useful to be aware of those. There'll also be differences in terms of the sources of the characterization factors. So if we take the emission factors for energy as an example, if I was looking at the carbon dioxide equivalents associated with a kilowatt hour of energy, and I sourced that from UK government data sets, and if I was using the same reference year, then in fact the figures would be about 7% different versus those that are reported in EcoInvent, which is a commonly used source within life cycle assessment. So there'll be differences just purely based on the use of different emission factors or characterization factors. And the other main thing to be aware of are those differences in terms of the system boundaries of what is included or excluded between different studies. And there will always be a gap between what is measured and what's evaluated versus the true net emissions to the atmosphere. And that gap is what we call the truncation error, and that will be to varying extents depending on the study. And of course, every study will have differences in terms of the assumptions that are made, as well as the allocation methods. So where a given process is shared amongst multiple products, then actually the way in which we allocate those emissions may differ between studies. So essentially, this limits the generalizability of some of those absolute figures. And that's one of the challenges that we face within the field of healthcare lifecycle assessments. And in terms of what is put forward on the database, it essentially is a central one-stop point of access for all of those published healthcare lifecycle assessments to date. But at this point, there's not an evaluation in terms of the quality of the studies. So in terms of our next steps going forward, it really requires the development of an expert international consensus statement in terms of the conduct and the reporting and greater standardization of that, and to develop that consensus statement, and then to retrospectively evaluate all of the studies that have come to date. But you'll appreciate that that's quite an extensive process, and we'll be seeking research funding to help us on an ongoing basis to get to that point. But we have that as a future plan as such. Next slide, please. So we need to be taking those absolute figures with a bit of a pinch of salt in terms of the results that are reported, but that doesn't actually detract from the value and the insights that we can get from individual studies. And really, to my mind, there are 4 key ways that life cycle assessment can be useful, and ways in which it can be used as a tool to actually inform our change in policy and practice. So I don't tend to worry about the absolute figures, but actually it's more about what are those valuable insights that we can derive from those studies. And the first key way in which these life cycle assessments can be used are to actually evaluate a baseline in terms of environmental impacts, and to use a consistent method to then monitor progress over time. The second key way would be to look at a given product or process and to identify the hotspots within a given system. And there are such growing numbers of people that are really engaged in this area and really wanting to know what they can do to have an impact. And I think if we can identify those hotspots and steer people when they're making changes towards those areas that have the greatest contribution, then that's how we're going to be able to maximize our impact. And the third key way is where a given study uses a consistent method, so consistent system boundaries and so on, to actually then compare alternative products. So of course, as I mentioned, we'll need to have caution when we're comparing products that are evaluated across different studies, but where it's within a given study, that could be helpful. And finally, we can use LCA to actually model and evaluate how to optimize a given process. So for example, that might be using scenario analysis or sensitivity analysis to look at those key parameters, so the key determinants of a given life cycle assessment, and those might be the ones derived through the hotspot analysis, but then to see what happens when we change and alter some of those parameters. So for example, that might be changing the mode of transportation, changing the energy supply, changing the number of uses of reusable products and so on. So essentially, I think apply a bit of a pinch of salt in terms of the absolute numbers, but there are many things that we can learn from looking at these sorts of studies. Can you go to the next slide, please, Johnny? So I've got the nice job now of actually thanking some of our collaborating institutions that have all been involved along the way. So HealthcareLCA is a collaboration between CASCADES, Brighton and Sussex Medical School, and Dalhousie University. And this is through the Creating Sustainable Health Systems in a Climate Crisis, which is a flagship project at the Healthy Populations Institute, which is co-led by Dr. Daniel Rainman and Dr. Sean Christie, who kindly introduced this evening's session. But we'd like to especially thank CASCADES. CASCADES stands for Creating a Sustainable Canadian Health System in a Climate Crisis. And they're supporting us in the ongoing maintenance of this database. As you can imagine, it's quite a labour-intensive process, but we've been able to recently appoint a fantastic new research assistant called Sage, and Sage will be working with us to ensure that the database is kept up to date. And just a little bit of a background in terms of CASCADES. So it's a Canadian capacity building initiative, which seeks to address healthcare's contribution to the climate crisis. So it's led by the Centre for Sustainable Health Systems, which is based within the University of Toronto's Dalhousie School of Public Health. And that's a partnership with the Healthy Populations Institute at Dalhousie University, as well as the Planetary Healthcare Lab at the University of British Columbia, and the Canadian Coalition for Green Healthcare. And CASCADES itself is funded by the Environment and Climate Change Canada's Climate Action and Awareness Fund for community-based climate action projects. So we're grateful to all of these different institutions and the role that they played in helping us get to the point that we are today. But looking ahead in terms of our next steps from here, so we continue to regularly monitor the various different databases, including Scopus, PubMed, Embase, and Google Scholar, keeping an eye out for new studies using our various search strategies, and working hard really to keep the database up to date and to make these studies available as soon as possible on the database. But we are exploring machine learning approaches. I noted one of the questions in the chat was asking whether it's a time-intensive human-based process or if we're using other technologies. But it's really thanks to Jono and now working with Sage also in terms of actually the hard work behind all of this. Another recent development is that we've actually made an author contribution form available online, and we're really hoping that that academics in the field will actually want to put their LCAs forward and to actually fill in the form, and that helps with ensuring that the endpoints and so on are all presented as they would like. But we're also going through a process now of author-based verification, and we're emailing individual author groups with summary data based on what is then featured within the database, and to really request their review and approval. So we'll be rolling out this process and starting with the new studies, but then addressing the backlog of which we've obviously got near a couple of hundred, which is fantastic, really. Next slide, please. I mean, fantastic to see so many studies in the field. So I'm just going to leave you now with the key links from today. So the first is the database itself, and feel free to follow us on Twitter at HealthcareLCA. And here you can find all sorts of interesting tweets in relation to studies as they come about. And there's also a link to our open access publication in Lancet Planetary Health, which was actually published to coincide with the launch of the database, and that serves not only to describe the database, but it also serves as a contemporary review of the healthcare lifecycle assessment research field. There's also a link to that tutorial video with further guidance in terms of actually navigating the database itself. So I think there's been a few questions coming through on the chat, but if you have further questions, then feel free to post them on the question and answer chat function. But I'm going to hand over to Kate now, who will be facilitating the questions. So Kate is the Communications and Events Coordinator for CASCADES. It's been great working with her in making today possible.
Thanks, Chantelle. Yeah, so we've got a few questions in so far. Some of them may have been answered in passing, but I'll go through them really quickly in case there's anything you want to elaborate on. So we'll start. We have a clarifying question from Alexis. The database is open access. Are the studies themselves open access, or are some of them behind a paywall?
You're on mute, Johnny.
Yeah, sorry about that. So yeah, the database itself is open access, but a number of the studies that are included within the database and the physical full text will be behind a paywall. But that just depends on the journal with which they're published in, and we have no control of that, unfortunately. Yeah.
If only. Is it possible to view the emissions associated with a specific stage of an LCA? So the example given is if an article calculates the cradle to grave emissions factor, but also includes the emissions or percentage of emissions from each stage, is that visible directly on the database?
Yeah, really good question. At this point in time, no. I think it would be really useful. It will be a bit of a challenge to implement. But I think it's something we will definitely consider down the line. One of the key challenges is getting the alignment between all of the respective life cycle stages. And studies will report that differently, which is why standardization within the field and kind of a consensus statement would be really helpful. But any sort of process to try and do that would require a considerable amount of matching life cycle stages according to kind of a system that we developed. And then there's also the logistics of inputting all of that data and also finding a way to kind of house it within the database. And the database would probably need to be a little bit more complicated to facilitate that. But it's something we would like to do.
Yeah, actually, and maybe that leads us into the question that Chantelle alluded to about automation. And if it's possible at this stage to share a little more about what that might look like in the future, or is it too soon to say?
It's likely too soon to say. Sean has connected us with a professor of computer science at Dal. But all those sorts of discussions are very early in the process. I suppose the kind of key question is, at this point in time, it's fairly manageable to kind of keep up to date with the field manually, and with Sage's help now inputting studies, that becomes easier. But if you think about the chart that I showed earlier, showing the kind of almost exponential growth within the field, I think there's certainly a role for AI and machine learning approaches to try and help with this process moving forward. But it is very early stages, and there would need to be some sort of process of kind of if we went down that route of continuing to manually input studies and then having a machine learning approach alongside, and then kind of evaluating the two compared to each other. So again, that's a lot of work, but it's something we're considering for sure. Yeah.
Great. So I'm not sure who this question would go to. The question is about how the assessments accommodate the difference between different countries through their use model. So this is a little bit about those data considerations, Chantelle, and possibly for Jono, a question of how we navigate those sorts of limitations and considerations. While I'm speaking, I'll also just note for our audience, we've hit time. We promised to end this at 3:45 Eastern. It's now 3:45 Eastern. We're recording, and the full recording will be available next week. So if you do have to leave us right as scheduled, you'll be able to see the end of the Q&A then. So please go ahead.
Yeah, absolutely. So in terms of the studies that are presented here, the actual country that they're based on is actually specified within the database, but it's limited to the analysis that was conducted within the study. So there's not an additional modeling in terms of what would happen if you were to use a given product, or if you were to undertake a given healthcare procedure in a different country setting. And to do so, you'd need to take into account a number of factors, including differences in terms of the proportion of renewable energy sources within the energy supply, and factors relating to changes in the distribution of any of the products and so on. But it would certainly be an interesting area for future development to actually be able to draw out those parameters and to alter them based on the different countries in which he might be wanting to apply the findings of a given study.
Alexis, I see your follow-up to that question. I think Chantelle's answer addressed that. And in the interest of time, I'm going to leave us with an anonymous question, which possibly is impossible to answer, but I'm interested to hear your responses. What has the absolute greatest impact on climate change within a health system?
So, I mean, I think in terms of the best evidence that we have to date will be those studies that have looked at national level healthcare services and which have then broken down the national level emissions according to different categories. And the best illustration of that, or the one that's I suppose closest to me, based in the UK, are those that have been developed by the Greener NHS. And here we find that of the 25 million metric tons of carbon dioxide equivalents, 2/3 of our carbon footprint relates to the supply chain. So it's really those scope 3 emissions relating to the stuff that we're buying. And that includes our medical equipment as well as our pharmaceuticals and non-medical equipment. So really engaging with industry is going to be important in terms of us actually bringing down our emissions within healthcare. So as a broad group of things, then it's really the stuff that we're procuring that have the greatest impact.
I think that's all we really have time for. Thanks, Kate, for leading the Q&A. And thanks again to everybody for coming today. We really appreciate it. It's nice to be connected. Stay tuned. We'd really like to be collaborative in everything we do moving forward. So feel free to reach out. And we look forward to continuing work within this field.